Common type 1 and type 2 diabetes symptoms you should never ignore. According to a new report released by the CDC, more than 100 million Americans have diabetes or prediabetes. About one-third of people who have diabetes, approximately 8 million adults, are undiagnosed and unaware of their condition. Being able to recognize type 1 diabetes symptoms and type 2 diabetes symptoms is a vital part of catching the disease early on and forming a treatment plan. Prediabetes symptoms often do not exist, and many early symptoms of diabetes are largely unknown and go unnoticed. The exact cause of type 1 diabetes is unknown, but it usually develops when the body's immune system destroys the insulin-producing cells in the pancreas by mistake. Risk factors for type 1 diabetes include family history. Anyone with a parent or sibling with type 1 diabetes has a greater chance of developing the condition. Genetics. Certain genes in the body may indicate an increased risk of developing type 1 diabetes. Age. Symptoms of diabetes in children or adults can appear at any age, but most commonly appears at two peaks. The first peak is between ages 4 and 7, and the other peak is between ages 10 and 14. Symptoms of type 1 diabetes in children include extreme fatigue, extreme thirst, constant urination, abdominal pain, nausea and vomiting, blurry vision and wounds that do not heal. Type 1 diabetes symptoms: feeling thirsty frequently and having a dry mouth, changes in appetite, fatigue, mood swings, blurred, worsening vision, slow healing of skin wounds, frequent infections, unexplained changes in weight, heavy breathing, loss of consciousness, nerve damage that causes tingling sensations, pain and numbness in the limbs, hands and feet. Type 2 diabetes develops when the body becomes insulin resistant, or when the pancreas stops producing an adequate amount of insulin. Symptoms of diabetes type 2 in adults may stem from genetics or environmental factors. Risk factors include weight. Being overweight is a primary risk factor for type 2 diabetes. Fat distribution. A body that stores fat primarily in the abdomen has a greater risk of developing type 2 diabetes. Inactivity. The less active you are, the greater your risk is of developing the condition. Family history. If a parent or sibling has type 2 diabetes, your risk may increase. Age. The risk of type 2 diabetes increases as you age, but type 2 diabetes is also increasing in children, adolescents and younger adults. Symptoms of type 2 diabetes in children include unexplained weight loss, dry mouth, fatigue, constant urination, blurred vision, heavy breathing and itchy skin. Type 2 diabetes symptoms: chronically dry and itchy skin, patches of dark, velvety skin in the folds and creases of the body, frequent infections, unexplained weight gain, pain, swelling, numbness or tingling in the hands and feet, loss of libido, reproductive problems and sexual dysfunction.